Hello fellow riding enthusiasts, my name is Jason and I'm an adventure riding enthusiast. My buddy Jean and I will be making a very special trip to ride our bikes in the Himalayas in a couple of weeks' time. And before we go, we just wanted to make a quick video of us training as well as to tell you the purpose of this trip that we are going for. As part of the content that we are making around this trip, we are actually doing it in order to raise awareness for 3 cancers that are seldom talked about. They are prostate, liver, and kidney cancers. And throughout this trip, we'll be finding out more about these 3 cancers, their symptoms, their treatments, and what it means for the average person out there to understand their risk factors for these 3 cancers. In order to talk to us and tell us more about this, I have someone very special to talk to me today, and let's go meet him together. Good to meet you. Yeah.
Same here.
All right. Thank you so much. Dr. Wong, before we start the interview proper, for the sake of our listeners, can you please just introduce yourself?
Good afternoon. My name is Dr. Wong Siew Wei. I'm a senior consultant in medical oncology, working at Parkway Cancer Centre at Gleneagles and Mount Elizabeth Novena Hospital.
So, Dr. Wong, as you know, as part of this trip, we actually want to use the content that we are making on this trip to raise awareness for 3 major cancers, right?
Yes.
Prostate, kidney, and liver. Before we go into the talk about cancers and all that, let me just ask you, how was the little ride around on the motorbike? First time in what, 20 years?
Easily 20 years, a bit nervous, not used to it. Lost some balance.
Bike riding in general in Singapore is fairly safe, in my opinion, right? We ride mostly on roads, very, very good roads. In general, it's quite safe. The thing is, once we go outside of Singapore, the roads can get a bit treacherous. You know, especially when we go off-road, loose sand, gravel and things like that. That's why for a lot of us who actually do adventure riding, last year I was in Georgia riding through the mountains. The year before I was in Mongolia also riding. And you realize that a lot of preparation and all that is actually needed in order for us to be ready for these scenarios. Yeah.
1, 2, 3, come on.
So let me talk to you a little bit about these 3 cancers, right, that we mentioned. How prevalent are these 3 cancers here in Singapore?
So when we talk about prostate cancer, it's actually the commonest cancer in Singaporean men. And in fact, 1 in 20 Singaporean men will have prostate cancer by the age of 75.
1 in 20, yeah? That's quite a high number, isn't it? Yeah.
It's almost like every classroom may have 1
Exactly.
student with prostate cancer when they get old. Yeah.
Exactly. I can think of 20 guys I know. You're telling me that within this group of 21 is likely to get prostate cancer.
Yes. The other thing that is worth pointing out is 3 in 10 of these prostate cancer cases will be diagnosed at stage 4, largely because of lack of screening tests done for this population.
I see. Well, before we dive a bit deeper in prostate, tell me about the prevalence for liver and kidney as well. Are they linked, these 3 cancers?
They are not linked. They have their own individual risk factors. Kidney cancer, the incidence is actually increasing over the past decades for various reasons. It's actually ranked number 7 amongst all cancer in Singaporean men.
Wow.
And every year we expect about 800 new cases in Singapore.
800 new cases of kidney cancer every year. Wow.
The reason why it's increasing is not well understood, but part of it could be because we are doing more scans for unrelated reasons. For example, non-specific abdominal pain or urine infection. They do ultrasound and they pick up lump in the kidney. So we may be picking up smaller kidney cancers from incidental findings.
And what about liver?
Liver cancer incidence is overall starting to decrease a bit, and we may see a plateau, but it may not dip down fully, largely due to a change in the risk factor prevalence. So we see more adoption of widespread hepatitis B vaccination, which was huge risk factors
I see.
until recent years. So incidence of hepatitis B infection is decreasing, especially in younger generations. In a richer society, lifestyle is different, so we have more incidence of fatty liver.
Oh, fatty liver. Yes, of course.
Fatty liver does cause scarring and inflammation of the liver, and it's going to be one of the biggest risk factors for liver cancer going forward in modern societies, not just in Singapore.
Wow, that's interesting. And There's so much to unpack in the 3 cancers that you just mentioned, you know, the reasons for it and all that. But I want to pull back to what you were talking about for prostate cancer going undetected generally to a very late stage. Why is it getting detected so late in men?
With many cancers, most of them do not cause symptoms at early stage. So prostate cancer typically starts on the outer part of the gland, which is far away from where the urine tube flows in the center. So most patients do not have symptoms, and as men age, some of them may experience slower urine flow, more frequent urination due to enlarged prostate, not due to cancer. And these may be confused with symptoms. Some patients may not address this change in their body for quite some time. So it's overlapping. By the time someone actually develops more florid symptoms, actually quite late. For example, if you have pain in the bones, that's actually a stage 4 symptoms where the cancer has spread to the bones.
Wow.
So there is this test called prostate-specific antigen, PSA blood test. It is a very simple test, straightforward, can be done in many places. In recent years, there's a bit of controversy who should be considering this test because there is a bit of issue with false positive in this test. So anyone with very enlarged prostate, sometimes the reading may come back borderline high. Overall, the most current recommendation is to still discuss PSA-based blood tests with your GP when you are aged between 55 to 69.
Okay, 55 to 69 is when you say maybe when you're doing your annual health screening, definitely do a PSA test.
Consider it. There are pros and cons. The general public can look up special write-up by Singapore Cancer Society about what are the things to look out for in terms of PSA testing, what are the pros and cons before they take action. But overall, I think for average risk men, they should consider it if they're going to go through some form of testing.
And when you say average risk, is basically anyone above the age of 60, right?
Above the age of 55.
Above the age of 55.
Average risk means those without very strong family history of prostate cancer.
Oh, got it. I understand.
So those with very strong family history, they may have even higher risk. They may have to discuss things differently. They may have to start screening even at an earlier age.
Got it.
Depending on their individual circumstances.
Dr. Wong, at the risk of stating the obvious, right? Why is it essential that men should be trying to pick up this cancer early rather than at stage 4?
So stage 1 and 2 prostate cancer is very treatable. And in fact, the earlier stage prostate cancer, some of the cases can be observed carefully, what we call active surveillance.
I see.
And the plan can be drawn up between the treating specialist and the patient themselves. And typically these apply to very early stage, lower grade cancer where very few biopsy calls come back positive. For stage 1 and 2 prostate cancer that requires surgery or radiotherapy as the main form of treatment, the cure rate is very high, in excess of 95%.
Wow.
And we expect many of these patients remain alive and well, even 10 years on the track after treatment.
So I think to summarize this point about at what point you discover your cancer, stage 1 and 2 would be the ideal points to realize that you have it, right?
And if you can intervene during this stage, not just much more efficacious result, the side effects tend to be not as intense. For example, if you require radiation, the area of radiation is probably a bit smaller than a stage 3 cancer patient.
Right, which has already spread to, like you were saying, the bones and all that.
Not the bones, but towards the capsule of the prostate, towards the neighboring lymph nodes. So they may require wider area of radiation. So over long term, this may result in slightly higher side effects.
Understand. How about for kidney and liver? Is it the same? Does early detection make a lot of difference?
With most cancer, the earlier you detect, the earlier stage it is, the more treatment options and more efficacy with the standard treatment options. Kidney cancer, we also do not see patients coming into our clinic with early symptoms because it's a pair of organs sitting at the back of the abdomen. And again, most of the cancer starts on the outer part of the kidney. We don't encounter blood in the urine as a very early sign. Sometimes it's stage 2, sometimes stage 3. Typically, stage 1 patients do not come in with blood in urine. I would say do pay attention to any form of scans that you have done for unrelated reason. If there's mention of a lump inside the kidney, please make sure it's not something that we call solid lump or semi-solid lump, which may contain higher risk of cancer progression versus cystic lump. Otherwise, in terms of other symptoms to look out for, definitely if you ever encounter urine in the blood that is persistent over a few weeks, please do discuss it with your doctors.
Okay. So I'm going to ask you some very layman questions that come from maybe the riding community. Those of us who love riding, we spend a lot of time on our bikes. Does this increase our risk in any way with regards to prostate cancer or liver and kidney?
Definitely no. We love everyone to be active in their life, so that will decrease obesity and other issues. In terms of riding specifically, I would not have any concern about elevated risk of cancer. But one thing to mention while we are on this topic is if you ever come in for PSA blood test, perhaps not to do it within 5 to 7 days from your last rigorous riding, because it may actually push up the PSA level that may create unnecessary alarm.
How interesting.
Yeah,
I didn't know that.
There's some additional pressure on your prostate while you're riding rigorously.
Yes. So you heard that, riders. If you're riding rigorously, try not to go and do a PSA test within how long? 5 to 7 days. Okay, let everything calm down there before you go and do your PSA test. Don't be unduly alarmed. False positive, was that what you called it just now? Okay, let's try not to get a false positive on that and scare ourselves, all right? So Dr. Wong, another question around for men around my age and older, okay? The big question around alcohol drinking and what that does to the liver, and we hear so much about that. Does alcohol drinking contribute to your risk of getting cancer of the liver?
Yes, definitely. Anything that causes liver inflammation in the long run will increase your risk of liver injury and liver cancer. So alcohol is one of the identified risk factors, especially alcohol excess. But in general, alcohol does not just elevate the risk of liver cancer. There are other long-term health issues associated with alcohol as well. Cardiovascular disease and other issues.
That's true.
For men and women, there is a guideline what is safe consumption. Obviously, no consumption is better than any consumption. But
Right.
if you must drink, perhaps limit yourself to 2 standard drinks per day for men and 1 standard drink per day for women.
Okay, thank you very much. You heard those guidelines, all right? It's going to be up on the screen right here just to remind you guys that alcohol, as enjoyable as it is, does present some risk factors for us. One more causal effect that I often see on the internet in comments and things like that, right? Sexual activity. Is the lack of it or too much of it a precursor to, or does it put you at risk of prostate cancer?
Not in particular. There is no risk with either spectrum of.
Good. So you just heard that from the oncologist. I see that in comments all the time, right? And I just want to put it out there since the vast majority of our readers here may or may not have medical knowledge. So let's deal with the questions that they want to know and they are asking, right? Okay, let's move on from this topic of the symptoms and the early detection, and let's talk a little bit about preparation. So let's say, for example, someone unfortunately gets a diagnosis. It's a very poignant moment in their life, I'm sure, for them to have this diagnosis of cancer. And there's a lot of things going on in their minds. And as an oncologist, you're often, unfortunately, in the position of being the one to deliver that news, right? Of a person's cancer diagnosis. I'm drawing that to a brief parallel to us preparing for a long, rugged trip, like what we're doing. And, the mental preparation, the physical preparation, and of course, other things that go into it. Talk to me a little bit about that mental state that a person is in at that moment. And what do you advise as an oncologist?
So, I guess no one is really prepared to receive the news of cancer diagnosis. It will come as a shock to most people, and at different stages of life, it will impact them differently. Typically for prostate cancer, our patients will be aged above 60s. Some of them will just enter retirement phase at that time, and they have to deal with a diagnosis of cancer. If it's early stage, they just have to spend a few months to get through the treatment and recovery. Whereas if it's late stage, they will have to spend quite a few years just maintaining regular visit to doctor's clinic to stay well.
Maybe drawing from our perspective, right? There are a few key things that I look at when I'm doing a adventure riding trip. That I'm going out there to embark on it. I look at what am I going to face in the days ahead? What are terrain? What do I need to prepare for? I look at the support and communication. In these days, we're so tied into our communicative device, right? The thought of riding up the mountain and losing communication completely actually scares me a lot. But it's part and parcel of the ride. So I look at a few areas of preparation that I need, not to mention the skills that I need in order to be ready for a trip. What are some of the key things that you advise cancer patients who just got a diagnosis to look out for and to prepare for?
So obviously at the start they have a lot of information to absorb. First of all is their diagnosis and their stage, what kind of treatment they will need. I'll encourage them to speak to various people, including doctors from different specialties, because in a lot of cancer, we are approaching it in a multidisciplinary profession. So you may hear something from the surgeon, something from the medical oncologist, something from the radiation oncologist. And once you get the big picture, you have a better understanding how to best manage your cancer. So that's first thing. Second thing is knowing what's going to come. As you say, having the knowledge in your mind, knowing what to anticipate. What are your weeks like in the coming few months?
Yeah.
What to look out for in terms of side effects? Can you attend certain things within your next few months in terms of social commitments? All this, once you empower the patient, once you let them have some control of their lives, it makes things a bit easier for them. There are various sources of information in terms of treatment-related side effects or schedule. There are reputable websites drafted by various organizations that will explain the treatment to you. If it's a surgical procedures, there are also websites that will guide you what to expect, what kind of recovery, how invasive is the procedure. If you are pointed towards the correct direction, you will feel more reassured, you know what to expect, and then you hope for the best outcome with the treatment actually.
Got it, yeah. And I think as a helpful resource for a lot of our readers, if for any reason you are currently looking into resources with regards to these 3 cancers, we'll put some helpful links in the post copy of these videos for you to go and find out more information from reputable sources. I think this is a very crucial thing today on the internet. All right, so this has been a very helpful conversation with Dr. Wong, I think. Dr. Wong, I myself learned a little bit.
I'm learning riding as well.
Yes. And you got a chance to get back on the bike. How amazing is that, right? In a couple of weeks, my buddy Jean and I will be heading out with a group of riders, and we'll start to tackle the Himalayan mountains. And along the way on our trip, we will be checking back in with Dr. Wong, and we will be talking about the various aspects of cancer treatment, as well as, you know, what to be prepared for and what are your options and things like that as we go through this whole journey. Dr. Wong, thanks for almost coming on this journey with us, except that you're not on the bike ride, but I'm sure there's a lot more that we can learn as we go through. We'll be sharing with you about what we are going through on the ride. We'll be telling you what we're experiencing. Those of you who are watching, we are doing all this because we love to share with you our passion about riding, but we want to take it a little step further to give you some medical advice and help about very, very serious topic, and that is the topic of cancer, and these 3 particular cancers, liver, prostate, and kidney cancers. Thank you so much for joining us on this episode once again. As you can tell, we have a lot more interesting content coming up very soon, the minute Jean and I join our group and we hit the Himalayas on our motorbikes. But before we go, Dr. Wong, are you forgetting something?
1, 2, 3.